Hello everyone, my name is Dr. Martin, and today we shall be discussing a very common topic, keloids, what you people would call enkovu, I think in Uganda as well. So keloids are easily one of the most common conditions that I deal with in my practice. And I just thought today we'll just discuss a few things as regards to what they are, what causes them, and how do we commonly treat them as well. Yes, so a keloid is what I would call a product or a result of wound healing. So if you imagine yourself getting a wound, either from an accident or from any other form of trauma, maybe you fell down, or maybe someone has pierced you, or even an insect bite, anything that just gives you a wound on your skin, that means that wound could potentially heal with formation of a keloid. The other thing that we think about also is skin infections. For example, things that gives you maybe a pimple or any other skin infection that irritates your wound enough to cause a wound, that can potentially also give you a keloid if that wound is healing. So let's imagine that we have our wound. This is what our wound looks like. The wound has been created here, maybe from an accident or anything else. Now, these are the boundaries of the wound. And that wound, once it's created, the body has to think of a way of allowing it to heal. And that healing process usually leads us to the formation of a scar. So the scar should be, this is our open wound. The final result, once the wound has healed, should be what we call a scar. Now, when that scar is formed, the body stops the healing process, or at least the collagen forming or the scar forming process should stop. But in the keloid, that process, there's usually a problem with that process, and that process just continues on despite the formation of that scar. So you find that with the keloid, if you have your initial wound, as we've seen here, it should progress to form a scar, and that scar should remain within the boundaries of the wound, as you can see. Now with the keloid, the scar forms and it goes all the way beyond the boundaries of the scar and of the boundaries of the wound. Then now you have formed what we call a keloid. So anything that, as the wound is healing, if that scar goes beyond the boundaries of the wound, now we call that a keloid. So what causes a keloid? We can't we can't say for sure that one thing that we could say this causes a keloid, but there are certain things that increase your risk of you getting one. And one of them is the race. The fact that you are of the black race means you're at an increased risk of getting a keloid on your the keloid kind of scar. Also, one of the other important things is the genetic predisposition, which means that if mommy has a keloid, daddy has a keloid, then the odds or the chances of you getting a keloid are also quite high. So the genetic predisposition and also the fact that you are of a black race means that we are at an increased risk of getting keloids. And I try to discuss this with my clients when we talk about elective procedures, because you don't want to be getting a keloid coming off an elective procedure which you could have done without doing. So, you have to have a discussion, or your surgeon must have a discussion with you as regards to the chances of you having this keloid when you're going to undergo a surgical procedure. So what are some of the presentations? How does a keloid present? How does a person who has a keloid look like? So they obviously have a scar. And that scar, like I said earlier, has gone beyond the boundaries of the wound. So the common places where you find a keloid will be, for example, on the earlobe of the ear. It could be on the shoulders, on the anterior aspect of the chest. These are some of the common sites where you most likely find a keloid. But a keloid can form anywhere where there is a wound on the body. So when it comes to management of keloids, there are principal ways in which keloids are managed. The things to think about are pressure. The second thing to think about is a steroid injection. The third thing to think about is surgery. The fourth thing to think about is radiation therapy. And then in some centers, if you're lucky, you might come across what we call cryotherapy. But this is not so common or readily available. So these are the principal forms of treatment that we use to treat a keloid scar in our setting. So if you think about is pressure. This pressure usually applied using, for example, any compression garment that you might use maybe after surgery on the scar. The commonest form, or the one that is usually has been agreed upon by in science, is what they call the silicone um, dressing, or the silicone. Any dressing that contains silicone within it has been found to have a higher chance of reducing your risk, or have a higher chance of reducing your risk of getting a keloid scar. So if you have your scar and you have your um, you have your scar, you've just finished surgery. For example, you've had a cesarean section, and then you apply your silicone gel sheet, for example, just above the scar for a long period of time. That has been found to have a higher chance of reducing your risk of actually getting a keloid scar. The others, which is quite common in advanced patients, is when they put on compression garments over their scars. That might also help reduce the risk of you getting a keloid scar. Steroids are easily probably the commonest form of treatment that we use. The commonest steroid that we use is called triamcinolone. Now we tend to use it especially when the keloid scar is a small scar, and we shall inject it, and it will then reduce the symptoms that are associated with this keloid. So things like itching, or if it's rapidly increasing in size, or if it's painful as well. When we inject that steroid, it tends to reduce the size of the keloid scar. It tends the amount of itching associated with that scar, and even the rate of growth is slowed down. So it's quite good mode of treatment for smaller keloids. So we tend to use them mostly for these smaller earlobe keloids, the triamcinolone or steroid injection. We use it over a period between every 4 to 6 weeks, and we use a total of between 3 to 6 sessions. That means that you've come to me today, and then we inject the steroid. You'll come back maybe 4 to 6 weeks later, we inject again, and then we do that about 4 to 6 times. And it tends to help with, like I said earlier, with the treatment or management of the symptoms of keloids. Surgery is probably another common form of treatment, but what I want to emphasize is that if you decide with your surgeon to have surgery as part of your treatment, it is very, very important to combine surgery with something else. If you do only surgery, there's close to an 80 to 90% chance that your keloid will come back. And as we all know, with keloids, one of the most frustrating things with keloids is that they tend to recur. So it's really, really important. If surgery is going to be used as a form of treatment, it has to be combined with another form of treatment. And the one that we commonly combine it with is steroid therapy. That means I might remove the keloid in that particular sitting. I then inject the steroid, and then you come back maybe 4 to 6 weeks later, we inject again, like that, maybe 4 to 6 sessions. The idea being you're trying to reduce the risk of this keloid coming back as much as possible. So surgery is a good form of treatment, but it must be combined with another form of treatment. The next one is radiation therapy. Now, radiation therapy, as you guys might be familiar, is that radiation usually what we use during treatment of cancers to try and reduce the risk of recurrence of a particular cancer. So with radiation, again, it's commonly used after surgery, meaning if I've had the keloid excised, it's important that we organize for you to have a session of radiation therapy as soon as possible, try and reduce the risk of the keloid coming back. So we tend to combine radiation with surgery to try and reduce the risk of recurrence. And in our setting, usually when we combine surgery and radiation, we look at it as the highest or the best form of treatment that we can offer a patient. If a patient's keloids come back after we've done surgery and radiation, then most times we usually have to we tell ourselves that our hands are now most likely tied, that we've run out of the best forms of treatment for our patients. And I've had a couple of patients who we've done all these forms of treatment, including radiation, and that keloid still comes back. And you just have to sit down with your client, with your patient, and tell them you've done everything you can, and now the best thing that you can do is manage the patient's symptoms, which can be quite frustrating for all of us who are involved. The other form of treatment is cryotherapy, which basically utilizes cold, as the way it's cryo, meaning cold. And again, they tend again to combine it again with surgery. So this cryotherapy is just like a mode of treatment in terms of also reducing the chances of this scar coming back, or the keloid coming back. It's a bit rare in our setting, but there are some centers that might be able to offer it. And if they do, then you combine that also with surgery to try and reduce the risk of our keloid coming back. So these are the principal forms of how we manage a keloid in our setting. And like I said before, it's important to really note that if you are going to do surgery, it has to be combined with another form of treatment to try and reduce the risk of this keloid coming back. What I also want to emphasize is that a keloid is not a cancer. A keloid is just a scar that has formed too much scar tissue, and the scarring process, which should have stopped, is still going on. So it's not a cancer in any way. And if you touch a keloid, there is no way that you will also be prone to getting one, because like we discussed earlier, the genetic the genetic component of your parents. If your parents had it, mommy and daddy had it, then you have the risk of getting it. But if I'm to touch somebody that has a keloid, then I will definitely not get it. Yeah, so these are the main forms. I would say these four, the key forms of how we manage keloids in our setting.